Hello, everyone. So I meandered back from barbecue
Hmm.
to run into one of my favorite students here, the Prez himself, Kenny from
Yes.
OCOM. And he's like, "Hey, Dr. King, you got a quick second?" I'm like, "Yeah, I'm just waiting for this to start." He's like, "I got pain," so I was like, "Let's
Doctor
fix it."
too.
So tell me about what's going on.
So I got upper back pain, and
Okay.
I know it's from studying a lot, being
Uh
hunched
huh.
over,
Uh
and
huh.
typing and reading my textbook,
Okay.
and
Left-sided, thoracic, or more like shoulder or
more.
lower?
I think it's more like left-sided thoracic.
Left thoracic.
Yeah.
Okay, okay. Any prior injuries, falls, traumas, car accidents,
Nope.
any sports injuries, nothing like
Nope.
that. So you know what the source is. It's
I
stability.
it's my
So
posture.
I'm glad we're doing this video because every student out there probably has experienced the same issue. I know I have. And we'll talk over self healing strategies at the end after I treat you.
Hmm.
But if you want to hop on the table, lie on your back, and we'll get started. So if you want to slide the belt off, that would help too. So students who are watching, what we're going to do is evaluate osteopathically, which means we're going to start at the bottom and work our way up through the whole system because of tensegrity, right? I like to start at the bottom just because that's our interface with gravity, is our feet on the floor. And so I'll just kind of see, if you want to bend your knees up, feet flat, lift your hips back down. Good. And then, okay. So your body just prefers this plantar flexion, which means your superficial back fascia up to the nuchal ridge in the back of your head is pretty tight.
Hmm.
So it does kind of fit with my clinical picture here. I use this method to check talar kind of positioning. You have a slightly anterior talus here, but not by a lot. And then I'm going to check here. We've got some tight fibularis muscles too. Knees. You are not hypermobile at all.
Stiff.
Congratulations. You're a stiffer person on that spectrum. Hips are tight, certainly, and this is your typical kind of spring test that we do.
Mhm.
I'm gonna bring this up. How do you like OMED so far?
This is so much
First
fun.
time, yeah,
First time, yeah.
yeah. So tell me about like some valuable things you've learned so far.
Well, I definitely learned a lot about like just advocacy overall and like
Yeah,
just to be proud of being a DO
yeah,
and everything
uh
here.
huh.
Um,
And really, how much it's across the country, right? Like how many other
yeah.
students from other schools and like have the same values. It's really nice, right? Push towards me. 3, 2, 1,
Mhm.
and relax. So based on the treatment I'm doing, can you guess the diagnosis you have? Push towards me
Uh,
and relax.
no, not really.
Anterior innominate. Push
Interior.
towards me, right? Because I'm using your hamstrings to pull your innominate
Yeah.
posteriorly, right? If it was a posterior innominate, I'd drop your leg off the table and have you use your hip flexors, right? And have you push
Oh.
up to the ceiling. So that's better, and we got to treat. Although I do want to check psoas, right? So not fun,
No,
right?
not fun.
So we'll have some more not fun times here. Just take some deep breaths. I'm just going to do a little bit of soft tissue here. And you might feel a little bit of radiation. You okay?
Yeah.
Just let me know. There we go. So what I'm doing is I'm doing like a counter strain positioning for the psoas, but I'm also doing some direct inhibition, um, and just trying to feel those myofascial, knots, restrictions going on. And as he breathes, I kind of follow his breath, and then on another exhalation, aha, we gotta treat this side.
Hmm.
So I like, my approach to innominate. It's pretty straightforward. Get a sense if they're anterior, posterior, in flare, out flare, sheared. Do a lot of articulatory, kind of like this. Just checking his range as I'm treating, right?
Hmm.
You can do a little fair test. Is that painful or tight at all?
Maybe it's hard, but
Maybe
not
tight.
painful.
Okay. So that's like a piriformis check, right? And then we're just kind of, getting the hip loose.
Yeah.
Just jiggle the doodad, as they say. Just get the doodad, move it around. Things kind of fix itself. Good. Any pain here? Rotation?
No, not really.
Okay. What did you guys learn next door? Bone biopsy now?
Yeah. So we just did some bone biopsy next door, and
Mm-hmm.
we used like the PSIS to kind of dig a needle in, and
Sounds really pleasant.
yeah.
So what are the indications for that? Just biopsying?
That's a very good question.
You're like, I should
We
know
just
the
did the
answer
hands-on part.
to that. Yeah. So I would think, right, maybe you're checking for,
Mm,
cancers or something. Maybe it's
yeah,
that, or
maybe for.
I'm not an expert. I'm an OMM guy, not a bone biopsy guy. Anemia. Any pain in the feet? No.
No.
Okay, so I'm gonna recheck the hips. Ta-da! So he's kind of globally rotated in his innominates towards the left, but he's side shifted left, and everything above it is kind of towards this way. So essentially, I would say he's like rotated right in his lumbar spine, side bent left. So I want you to lie on your right side, facing me,
Mm-hmm.
and we're going to just provide a gentle little lumbar, and then try to grab your elbows. Yeah, and then we're gonna twist the jar open. Okay.
Yeah.
Stretchy, right? Feeling that?
Uh-huh. It was good.
Yeah. Try to bring your hip towards the other table behind you and relax. You see how I use the room as cues?
Mm-hmm.
Because that helps you envision where you have to push. So push again towards that direction. You can use that with patience and relax. One more time. And relax.
Yeah, super helpful because I figure
Yeah.
out, like, I have a hard time
Mhm.
describing the patient
How to
where to
push.
move.
So just use the room. Lift
Mm-hmm.
your hips up, back down. So it's like go push towards the window, push towards the door, the trash can, push against me. Just basic stuff to kind of direct them. Because if you're like return to neutral or go side bent left, rotate right, they're gonna be like, what are you talking about? Like I have no idea. There we go. Okay, so now it's even. We're gonna treat his diaphragm here, right? Doming the diaphragm, always very good to do. Sorry if it's tender. See, he's doing his breath work, which is good. Yeah, there it goes. So I'm going direct right now. I want to go indirect. You don't have to follow all of the rules. You can make up things as you want. So he's got a left hemidiaphragm restriction. So I'm going to do a little more focused work here. Good. Uh-huh. Doing all right.
Mm-hmm.
Keep going. Deep breath. Yeah. Okay. Whew. Okay. Now we're finally getting towards his chief complaint, but we've addressed and we've kind of untangled everything below it, right? Because nothing is in isolation. So these chairs are all linked together, huh? Let me get this one. All right. So go up top.
Mm-hmm.
I'm gonna steal this incredible hat. I wonder who made these. These are amazing.
Yeah, it was the best hat.
It's the best hat ever. So
A lot of students were asking me about the hat.
I know.
Where can you find them?
Well, I'll be starting the brand OMM Saves Lives very soon. Can get them maybe. I like the plug. You can get them. You can get them when I post the website. Coming up in hopefully the next week or so.
Awesome.
All proceeds are gonna go towards students' programs at Rowan Virtual SOM, because that's what we need, right? So
Yeah.
we'll go to the side. But yeah, the demand for those has been pretty
Pretty high. OMM.
There you go. So, this is a technique literally everyone can do, right? Rib raising. Super useful. His ribs are restricted on that right side. And if you want to come see how I'm using my forearms, I press into the table and then I kind of rock his ribs up and in this like circular wave like motion. See how I'm not doing it super fast? I think the tissues need some time to start to release. So even if you want to do just like a long hold, there's no rules against that. Just press and hold. So what nerve / ganglia is under here, under these rib angles that I'm pushing? Superior sympathetic chain, ganglia.
Yeah.
Right, all your sympathetics are under here, right? And then we're just kind of working. Hello, you want to watch? You can watch if you want. Okay, have fun. And then we do this. I'll totally keep that in. You want to watch? Nah. Okay. So I'm going to go to this side. Then I'm just checking his trap, his levator scap, rhomboid with my left hand. I use this as like a long lever, control for his upper extremity. So as I bring his arm into adduction, that brings the scapula out towards me. I can hook that and pull and stretch, right? You can even turn this into muscle energy. So bring your elbow out towards me. 3, 2, and relax. You felt that snappy? Yep. Do that again. 3, 2, 1, and relax. One more. Good. Final stretch and okay, so when I'm addressing the scapula and upper extremity, I like to also focus on the anterior and posterior axillary folds. Now, patients might be ticklish, so you want to approach this with caution. Sorry if this is uncomfortable, but I'm going for the pec minor, under the pec major. So I'm aiming for the coracoid process in ribs 3 to 5. And feel tender here? Yeah. So when that pec minor is hypertonic, it kind of pulls the coracoid process anteriorly, creates this anterior and protraction of the shoulder, this anterior rotation. That kind of gives you that hunched kind of back look, right? So that's why in addressing all of these things, sorry, this might also be tender in the latissimus, that's going to create a better posture when you release both the pec, subscap, the teres, the lat. So I'm kind of working on all these. I know this is tender. And you probably were like, I didn't know that was there.
Yeah.
But this is all creating, especially that guy.
Yeah, wow.
See, yeah. See, that's something I might dry needle, maybe do some electrostim. But this has probably been here for like a few years. Yeah.
100%.
Yeah. And then kind of shake it out. There we go. And then I can kind of start to compare right versus left. Since I treated that right side, I would expect his shoulder to be more retracted and kind of down towards the caudad area. So yeah, so it's a little bit easier to spring. Check trapezius. Yeah. So this is locked, this upper left quarter here. So go around. So where are you from, Kenny?
I am from, I was raised in Port St. Lucie, Florida, and I've just been living my life in Orlando with OCOM.
Nice. You like Orlando?
I love Orlando.
Yeah, that's awesome. You're going to stick around, maybe residency to do that in Florida, or you want to move, or what do you want to do?
Honestly, I would prefer to stay in Florida, just be with family, because that's super important to me.
Okay.
But wherever I get accepted.
Do you have a big family?
Yes.
Yeah, that's cool. I'm an only child, so I don't know what that's like, but how many brothers, sisters?
I have 3 brothers, and I'm in medical school with my cousin.
Oh my gosh, that's great.
Yeah, Crystal.
Crystal's your cousin?
Yeah.
Wait, Crystal, like, I know the Crystal. Okay. Like the same Crystal? That's so fun.
Yeah, we enter medical school together.
That's special though, right? Like you guys go through this journey together. That's very cool. I know. So my right thumb is in the clavicular trapezius fibers. So they go to the kind of towards the acromion actually, where the AC joint is, and these fibers often cause tension headaches. So if a patient comes in and has this kind of question mark pattern, they're like, "Oh, it feels like it goes up and around." I would have this as a main suspect, right? And you can press and hold it, and if they say they feel it reproduce, that's indication for trigger point injection with either ropivacaine, lidocaine, whatever kind of anesthetic you want to do. So I can also release it with my thumbs, which is way more quick and immediate. So we're going to do a similar thing. So I'm hooking, pulling, trying to push out towards me. 3, 2, 1, and relax. Good. And again, 3, 2, and relax. Woo, good stuff. I know.
Ooh, that's even looser.
Yeah, but this is something maybe a needle might provide another level of relief too. So when I'm treating, since I'm also an acupuncturist, I map things a lot when I do OMT, and then the icing on the cake, as we finish with that needlework, electrostim, and then so we're working that pec minor. So did you always know you wanted to go to DO school, or did it just kind of happen in your journey?
Originally, I wanted to enter engineering.
Yeah. Oh,
and
cool.
I realized I sucked at all of the engineering.
Maybe not a math guy.
Yeah, I was like, maybe it's not for me, but I love science, and slowly I started going to like medicine-based science, and then when I started working at the hospital, that kind of like reaffirmed everything. I was like, yeah, I definitely want to be a physician.
Yeah, that's awesome. Do you have physicians in your family?
No, I'm first gen.
Wow, so you and Crystal leading the way. That's very cool. Well, I'm sure your family's like super proud, right?
They are.
That's awesome. So what's your heritage? Like, where's your family from?
Me and Crystal, we're both Dominican.
Oh, Dominican.
Yeah.
Oh, that's cool. I'm a big fan of Dominican food, that's for sure. I've been to Punta Cana a bunch of times. Yeah, Punta Cana's nice. That's great. So now we're looking at the cervical spine. Gonna check some range of motion, right? Some articulatory work here. So you can tell you are stuck, in this left side bending. Right side bending is a little bit easier. So we'll do some muscle energy here. So I like to do this kind of cross block. I can use my forearm as a nice little barrier. So try to bring your head to the right against me. 3, 2, and relax. And then we'll do this and do it again. 3, 2, and relax. Good stuff. And then, yeah, do a little bit more. Just one more. Go. Relax. Okay. So what have you learned so far from this treatment? Anything like different or new, or like how I'm operating here?
Yeah, kind of like that, using your forearm as a block, and like incorporate a lot of like muscle energy into your like treatment plan.
Yeah.
Because I feel like I kind of like get a little like stuck when I'm treating something, and I'm like, oh, like should I be doing HPLA?
Yeah.
Even though like I'm more familiar with the concept of muscle energy.
Yeah.
So just to be confident with that and be able to use it to treat.
And also to just like integrate things, right? Like you go with your gut, like, oh, I feel like I should do some soft tissue now, or maybe it's some MFR, or maybe like right now I'm doing just suboccipital release, kind of letting your body do its thing. So you just get a sense of that, and again, it's like the more you practice this stuff, the more you lock in that intuition and you're comfortable. So it's just like learning karate, right? It's like you got to go to class. You can't just read about it and be like, oh, I know karate. It's like, well, how many competitions have you done, or how many spars have you had? It's like 0. It's like, well, then you don't know. So do you have a favorite technique you like to use?
Honestly, seeing you treat, definitely muscle energy is climbing up
muscle
there.
Energy, yeah. Yeah. So now we're just kind of going along the side and like releasing the cervical spine. So this is another technique. I actually like to use the greater wings of the sphenoid with this hand, kind of just past the eyebrows, like here. And then I will kind of use that to, provide some control of the cranium as I'm releasing the muscles of the cervical spine. How's it feeling?
Feels great.
This is the moneymaker. If you only know this technique, you will have a waiting list. Just do this. I'm kidding, but serious at the same time. All right, do the other side. We'll go here. Do you get any headaches, migraines?
If I'm studying something really hard, I'll get a headache.
Yeah.
And then I'll just pop some ibuprofen and then keep on studying.
So you're just trucking through the somatic dysfunction, kind of like we all do, right? Happens to the best of us. We just gotta get the studying hours in. I'm gonna just check your rotation. So this is a simple way that I like to check rotation. I just kind of spring up. So he's not springing with my left hand, and he is with the right. So therefore, his vertebrae are more rotated left in the mid-thoracic. So I just try to simplify, right? This arm on top, this arm on bottom. Give yourself a nice hug. And then I'm just gonna locate, let's say T5. It's in the middle of that group I detected. I can do a little bit of side bending using the cervical spine towards that side. It already kind of went, but.
Ooh. Wow.
That's the money right there.
Yeah.
So I would say the diagnosis was really T3 to 7, rotated left side bend right, group curve. Now we are very even, which is nice. All right. So I wouldn't be a true osteopath if I didn't finish with some cranial work, right? So, and you guys learned some of that already, yeah? Yeah, flexion, extension, rotate left, side bend rotation, torsion.
Air sign.
Easier to learn initially. as an academic concept, I think it's harder to actually treat because the way you treat sometimes is like getting out of the way, which is hard to learn, right? It's like, how do you treat without treating? It's a paradox. So a lot of times I just kind of let my hands rest there, and then I try to listen with my hands and just see, what your cranium is wanting to do or say or move. Um, this is called a Becker hold. It's like in the shape of a bowl. This is the classic vault hold, right? Seeing my finger positioning, greater wing, temporal bone, more on the mastoid, but still temporal bone, and then the occiput. And then thumbs can either just gently rest or off the head. And the amount of surface tension I have, is like a water bug kind of walking along the water. Not trying to impart a lot of force. I'm just trying to use my hands as like these antennae, get a sense of. So he's got a left torsion, or sorry, a right torsion. My right index finger is floating a little bit more high. So if I want to treat a little bit more indirect, I follow that. And the heat from my hands too is helping a lot of this epicranial fascia loosen up. So it's both the heat component of your hands, the energetic component, the biomechanical components, the balance membranous tension components. Do you guys know about BMT, balance membranous tension?
Yes.
So tell me what that is. Right.
Oh,
So
yeah.
what is
Never mind.
BMT?
I don't know that one.
So BMT is for the cranial vault. You have your falx cerebri and your tentorium cerebelli. Those are like, these fascial membranes that house a lot of the, vestibular and fluid makeup inside the brain, splits your brain in half and also kind of in a transverse plane. So if you balance the tent and the falx, you'll get a balanced central nervous system, which can then improve the flow of your CRI. So what I'm doing here is through accessing a lot of the sinuses, right? Sagittal, cavernous, I'm also floating C1 with my middle finger. So there's a lot at play here. And we're just balancing. Cranial can be looking, look like grass growing or paint drying. It's not the most visually stimulating thing to watch, but I'm feeling a fair amount of stuff happening here. Good, doing all right. Cool. So as I feel things release, I'm gonna just start to shift my intention. So with cranial work, a lot of it is intention based, meaning you have to have the knowledge and the anatomical awareness to direct your energy or your observation. And that takes a lot of time. It's not easy. It's a very abstract concept. But once you kind of have that light bulb moment, whether you take a cranial course, there's, the SCTF, the Cranial Academy, they coach you, right? So they try to open your mind with certain types of exercises and ways that might resonate with different people. And then all of a sudden you'll be like, oh my gosh, I'm starting to feel it. It as in like the CRI, right?
Yeah.
So do you have any questions about it? You're just chilling.
We're just chilling, yeah.
Yeah. Good. So I feel like things have evened out pretty well. Recheck here. Cervicals are moving well. Thoracic. Okay. So after I do my cranial work, I like to go all the way back down. And I like to feel globally what we changed, what might be left. Okay. I'm going to do like this little bit of a, okay. Okay. Just a little something more. Right there. You okay?
Yeah.
So I was feeling that from his ankle. So a semi-lunar line strain on the right. You okay? It's radiating.
Yeah.
Yeah.
Just a little.
Yeah, just a little. So take a few deep breaths here. So I'll just do a little bit of this like rotatory soft tissue. You okay? Sometimes we'll do figure eights. This is kind of near his inferior mesenteric ganglia. Okay.
Does it ever get to a point where like it doesn't hurt?
Sometimes, yeah. Yeah. Good. You're healed. How are you feeling?
I feel great, to be honest. Wow.
So, what I would say is stretching wise, right? Certainly this stretch, you know, left hand in your right back pocket. So this one.
Like, okay, right
So
here.
switch hands. Do it with your
Oh,
left. And then take this hand, crown of the head, and gently pull it to your right shoulder. Yeah. So that's going to stretch a lot of that tight trapezius, all of
yeah,
that stuff. And you just want to hang out there. Sometimes I'll do it in the shower with hot water here.
yeah.
And you can also do kind of like this, like massage on the side, like soft tissue work on it.
Yeah.
Bringing your hand back kind of retracts the scapula, kind of opens that up, right? I would also recommend lacrosse ball, tennis ball, whatever density you like. Get that there, go up against the wall, and start working on it, like rolling up against the wall.
Yeah.
Like in between your shoulder blades and your traps, all of that stuff is fair game. And then, you know, upper cross syndrome, you learned about it, right?
Yeah.
So weak neck flexors, right? You got a weak mid back,
Yeah.
tight traps, tight pecs.
Yeah.
So if you stretch your pecs and your traps,
Yeah.
and you strengthen your neck flexors and your mid back, certain PT exercises, and it literally, if you YouTube upper cross syndrome fixes,
Yeah.
those things will pop up. That's going to be a daily maintenance type of thing that you want to do in order to, you know, combat this, because it's like, as long as you're studying, that's how much time you need to undo a lot of this stuff. So it's a fight. It's a constant battle. So what I would do, right? You study for a few, you know, study for a few hours, take a nice 20, 30-minute break. In that break, you got time to just stretch, like stretch out. You know, maybe you go to the fitness center, maybe you just like get loose real quick, and I think your studying's going to be better, your sleep, everything's going to just be better. So.
No, I feel like 100% better. Thank you so much.
Yeah.
Yeah.
Hey, see you next time.
All right.